On the burr block, there are two burrs. One is for the slow-speed handpiece and the other is for the high-speed handpiece. If you pick up the two burrs, one is going to be a latch-type shank round burr and the other one isn't going to be latch-type. The one that's latch-type goes onto the contra angle on the slow speed, and the one that's the straight fissure burr goes onto the high-speed handpiece. To place the straight fissure burr on the high-speed handpiece, you'll push this button on the high-speed handpiece and insert the burr, then release the button. Double check to make sure the burr is secured. If it's not secured, when the operator checks prior to drilling, you'll lose 1 point on your skill assessment sheet. Always remember to make sure the burr is secured when you set up your tray. On the slow speed handpiece, there is a latch type device in the back of the contra angle. Insert the latch type shank round burr into the contra angle and it's secured by the swivel of the latch type device. Always double check to make sure that the burr is secured. When the doctor places the topical anesthetic, the dental assistant will assemble the anesthetic syringe. Do not forget to grab 2 needles, a short needle and a long needle, since you will not know which tooth will be worked on until the operator takes a look in the mouth. We will be using the long needle in this case since we're working on tooth number 29 and the doctor will be giving the IAMB. Pass the anesthetic syringe with your right, stabilize with your left, and remove the needle cap with your right hand and place it into the needle capping device. While we're waiting for the patient to get numb, you would want to dispense the desensitizer, the dye-cal, and the cavity varnish. For the skill assessment, you're just going to pretend to dispense a little bit into each of the DAPN dishes. As for the dye-cal, you have to make sure that you grabbed the same manufacturer's catalyst and base. When we're using the dye-cal, you actually do not need a lot, you only need very little. Once it's dispensed, make sure that it's not going to be mixed until it's ready to be used. Don't be confused, we're still working on tooth number 29. This is a view from the dental assistant's side. would want to have a piece of gauze. After the operator is done using the enamel hatchet, the dental assistant will give a limited rinse on the cavity preparation. We'll just have you check the bite one last time. The last step prior to post-op instructions, the dental assistant would then give the patient a full mouth rinse. After the dental assistant gives the patient a full mouth rinse, he or she may retrieve the mouth mirror and cotton tip applicator back from the operator, or the operator can kindly set the instruments back down on the assistant's tray.